Want to welcome everybody to our video today. It's an interview where we dive into a topic that thousands of men each year, they face it, but is rarely discussed. And that is for those gentlemen who have just gone through a prostatectomy, whether it's a radical prostatectomy, or pelvic surgery. We at Tim Medical, we talk a lot about erectile function, but we don't talk as much about incontinence. So we have brought in today a guest, Vanita Gaglani, who is a physical therapist in the state of Florida, also the author of a book entitled Life After Prostatectomy and Other Urological Surgeries, where she focuses on incontinence, moving from that place to a place of continence. So we are honored to have you with us and just want to get started with some questions, but thanks for joining us today.
Thank you so much. I do appreciate discussing a very difficult topic for men. It is not something they go around talking even to their best friends about. So thank you for opening it up.
Well, you're welcome. And I was so drawn to you because you told the story about, for the longest time, you treated females, women, and incontinence. And then you had a gentleman, I think he was about 64 years of age, came to you and said, well, what about me? And you then prescribed a treatment plan for him, which is very holistic. And you share about his success with that plan where he moved from being incontinent to continence. So again, we're glad to have you, and I love it that you're in this space with men, but this is also applicable for women as we create this interview. But I want to start with a question. A gentleman has just gone through a radical prostatectomy, goes back to the surgeon, and they have their catheter removed. Now what do? They're sort of at a loss. They don't know what to expect, what they can do to move from being incontinent, if they are, to continent. What's the first thing you would say to a man to provide some encouragement as they're stepping away from that doctor's office and that catheter removal?
So usually when they see the doctor, the perception they have is they're just going to leak a few teaspoons or tablespoons of urine, which is incorrect because we don't know how much reconstruction is going on with the prostate, how enlarged it was, whether the cancer was at the periphery or it was in the center. All those factors go into making a person continent or how much leakage they have. So the first thing I would like to tell them is 98% of the men leak. 2% may not leak, but they are usually very young and very active, like in their 40s. The moment people hit 60s and all, there is a significant amount of leakage. And by significant, I mean it can be from 1 pad to 10 diapers a day. But there's nothing to worry about. It's normal. And it takes a few weeks, like any other surgery, knee surgery or hip surgery, to get back to normal. So again, talk to your doctor about it. Do not feel shy that I'm leaking. They are not going to discharge you as a patient or get mad at you. Let your friends know that you're leaking. Let everybody know that you're leaking so that they can give advice on how to improve. The second most important thing I would say is when you do find a physical therapist, ask them how many men they have treated, because the treatment for men is very different compared to the treatment for women as far as the pelvic floor rehab goes.
Very important. All right, that's good.
Because if you think about it, I had children. Women have had children or menopause, their pelvic floor is pretty slack and it's stretched out. So we have to hypertrophy each pelvic floor muscle to get back to normal so that we can close the gap. What happens in men is they have the bladder, the prostate, and the pelvic floor. Well, they don't really use the pelvic floor and it is pretty much in a good shape. What happens is they don't know how to use the pelvic floor with the bladder. So the first part is learning how to use the pelvic floor with the bladder. And that is body mechanics. How to stand up without leaking, how to walk without leaking. Later on, as you get better, how to golf without leaking, how to do yard work without leaking, cough, sneeze without leaking. So it is not that men don't have strength of the pelvic floor. What they lack is the endurance to sustain a hold till they can get to the bathroom because they don't know how much contraction or how much to engage the pelvic floor. So if you think about it, and I always tell people or men that if you think about it, if you take a very little tiny screw and put it in a computer, you have to start slow initially, but once the threads are proper, you can screw it tightly. Or if you have a tap which is leaking with a bad washer, if you close it suddenly, it's going to leak. If you close it too little, it's going to drip. But if you just get it right, it will drip, but it will be better. So we have to visualize the pelvic floor in men and compare it to these delicate things to start with, and then increase the endurance.
And I know in the book that you've written, you talk about that specifically in some of the exercises that men can do. But for somebody who's listening to this for the first time, and you're talking about strengthening the pelvic floor, and we talk about the Kegel exercises, what are some, what sort of movement are you talking about that sort of adjusts that spigot a little bit? What does that look like?
So when we do the Kegel is a contraction of the pelvic floor. And when the pelvic floor contracts, it closes the orifices of the vagina, the rectum, and the penis. Now, what happens is the pelvic floor is small like a hand. It is exactly like your hand muscles. You do squeeze the ball too many times throughout the day. By the end of the day, your hand is pretty fatigued and you cannot squeeze anymore. You hold a grab bar, at a point your hand's going to let go. Or if you raise your eyebrows for a long time, at a point you have to bring them down. So equate the pelvic floor to the hand or the face muscles and not the thigh muscles or the hip muscles. They are delicate. So they require a certain contraction and then they require a certain relaxation. And when we do contract the pelvic floor, it is, if you start stopping urine midstream, it is the equivalent of using your pinky in your hand instead of your thumb. So when I would suggest to everybody that when you do start with your Kegel exercises, you actually tighten the rectum, because when you tighten the rectum, automatically the pelvic floor also gets engaged. I mean, the front muscles get engaged. It is all the pelvic floor, the rectal, around the rectum, around the vagina, around the penis. It's all the pelvic floor, but the rectal muscles are your marathon muscles, your penile muscles are your sprint muscles. You have to treat them a bit differently.
Okay, that's good. I love that. It's a good approach. And you talk about pelvic floor exercises and some of those things, obviously quite valuable, but you also take a very holistic approach. So you don't just stay in that space and say, all right, every day you need to do these 10 exercises and you're going to be great. How do you round that out with your holistic approach to treating incontinence and moving to a place of being continent?
Right. So what happens is the pelvic floor is just a part of a whole system. We have the kidneys, we have the bladder, we have the ureter, and then we have the pelvic floor. So what is the job of the kidneys? The job of the kidneys is to take toxic material away from the body. So whether people drink water, anyone, men or women, whether they drink water or they don't drink water, about 2 ounces of acid is eliminated every hour through the bladder. Now, if you think about it, your bladder has had surgery there. They have attached the urethra in that area. So if you think about it, if you have a deep cut on your hand and it's sutured up and you put lemon juice on it, you can imagine how much your hand will contract. To mitigate the aggravation from the acid, I recommend people drink water. There are 2 reasons. A, it dilutes the acid, so it doesn't aggravate the bladder. It is not aggravated. It doesn't go into minute contractions. It's not that you get spasms. They are minute contractions. If it doesn't contract, the pelvic floor is not engaged all the time. So when you need to get up and move, the pelvic floor has enough strength to hold. But if the pelvic floor is constantly engaged, it gets so fatigued that you end up leaking. So it is counterintuitive. People think if I drink water, I'll go to the bathroom more or I will leak more. That is totally incorrect. In fact, the more water you drink, the less you leak. Why? Because A, water dilutes the acid, but also the bladder capacity needs to be increased. We cannot just have the pelvic floor. The capacity of the bladder also is important because you're not going to be stuck around the house all day. You may be gone for an hour, you may be gone for 2 hours, you may reach Home Depot, the toilet is closed. So your pelvic floor should have enough endurance to wait it out till you can find a bathroom, maybe an hour later, but it should be able to hold the urine for an hour without you getting very stressed about what am I going to do. Then there are some foods which normally, to start with, when you're recovering from any surgery, you try to follow some guidelines, and there are some foods which aggravate the bladder. All acid aggravates. What is acid? Processed food. Your sodas, your drinks like beer, anything with additives, the kidneys go in an overdrive trying to remove it from the body and you are trying to hold it. So you're trying to hold something in an injured place. It's not going to hold. It will push it out. So initially for a few weeks, I'm like, let's back off a little bit. You can have it occasionally. And then as you get better, we can reintroduce all the foods which you were not allowed to or which you shouldn't to gain continence. It is not that you can never drink it. Slow down initially, and then later on, when you're completely dry, you can re-add them.
That makes perfect
Then
sense.
there's body mechanics. So what happens is when I'm leaking or you're leaking or anybody else, what is the first thing we do? We try to engage the pelvic floor. We are like, if I hold it tight enough, it will not leak. But it is equivalent of holding a grab bar. The moment your hand is fatigued, you're going to let go. So if you hold your pelvic floor too tight, the moment you walk, 3-4 steps later, the pelvic floor will say, I'm done. Just relaxes, and that's when they get the gush of urine. So I have to show them body mechanics whereby they can control the urine and yet reach the toilet. So it is not just Kegel, Kegel, Kegel. It is nutrition, hydration, body mechanics, and other exercises apart from the Kegel. So it is a multi-pronged approach, which I teach patients.
All the things we already know in order to remain healthy. Now you're in a key moment in life, post-surgery, where it's time to pull all those resources back together and say, all right, I'm going to have to reduce my caffeine coffee intake and my soda intake so that I don't have this need to remove the acid from the body and urinate too much. But I still want to stay hydrated. So you're prescribing water in that part of that process, and other movements about walking, some body weight squats kind of thing, not just the Kegel exercises. So
not just the Kegels. It has to be the whole. If you look at the pelvic floor, all your abdominal muscles are attached to it. All your back muscles are attached to it. Your thigh muscles are attached to it. The pelvis is the center. And if one is not working, like supposing you have back pain, then everything will be contracted. And when something is contracted for a long time, it will release and you will leak. So we have to address every single part. Like constipation will cause leakage because the area is so narrow. So if your bowel is full, it will push on the bladder, and as physics shows, a solid will always win against the liquid. So you will leak. To approach all these, combine all these factors, but the goal is to be dry and no pad, and it can be achieved in a few weeks, no matter how much people think it will never be done.
And that leads me to the next question, because I think that is the fear that a lot of men have when they're first starting and they're dealing with incontinence. They're embarrassed about it. They don't know what to do. And so we men tend to go in isolation, and we're like, I'll figure this out. It's going to be fine. What would you say to a man who's feeling that level of embarrassment? Rather than struggle silently, what would you say to them in terms of finding some resources for encouragement?
What I have found is that when men start talking in the church or to, other people in the bar, they find out there's a whole lot of men like them who are leaking, not necessarily after prostate surgery. There are men who just leak for, they have an enlarged prostate or they just have weak pelvic floor muscles. So, but they never talk about it. Me and other women, if we leak, we are talking to everyone, we are going to the doctor, we are going to the gynecologist, we are like, do something. With men, it is like, it's not manly. So what happens is they try to strong arm the pelvic floor, which is the worst thing you can do. Because unlike your knee and your hip and your shoulder, you cannot strong arm the pelvic floor. You have to nudge it slowly. So interestingly, one of my patients, he told me, like I was telling him, do this gently. And he says, you mean steer slowly? I thought that was so appropriate, steer slowly. So when you talk to other people and when you think about it, the number of advertisements on TV about using diapers and playing with grandchildren, the number of pads out nowadays for men, underwear, which is like $60 for one underwear. Somebody's using them. People don't advertise something which nobody's using. So always know you are not alone. Talk to your doctor. He will find help for you. They know therapists. They will know what to do. Find your friends. There are support groups out there. Talk to them and rest assured you will get dry. It is not, there's 1% of men who have to go for some other surgery to rectify it. 99% recover. It's just like weight loss. A lot of us will do good with diet, exercise, multi-pronged approach. You will get that 1% who will need the stapling, but 99% do pretty good with lifestyle change. So that is all it involves, and then it becomes a habit.
And I think that provides such encouragement because I don't have to do anything else radical. I don't have to go in for surgery. I just need to adjust how I'm living. And I'm again thinking of that moment that catheter comes out and I'm driving away or being driven away from the hospital and heading back home. There's just so many emotions going on. I think if you can go into that point with a plan that's holistic, that's healthy, that's natural, and say, every day I'm going to do this. This is what I will take in terms of hydration. These are the movements I will incorporate into my life to get me quicker to that place. So I think that's good. And one of the questions I wanted to ask as we wrap up here is, I had mentioned that 64-year-old gentleman. I might not have the age right, but I think I remember that right. But he was so thrilled that he could move from being in a place of incontinence to continence. You've dealt with probably hundreds of men, probably since that moment. I mean, can you offer some words of encouragement around a specific patient who maybe had reached a point where I don't even know if I have any hope in this anymore, to a place where they were completely dry and satisfied?
So as of today, I started working with men when it was an emerging field. Nobody did that then. I have seen almost 5,000 patients. And if you go to healthgrades.com, which has all the reviews, there's a lot of reviews there. Everybody, they always say that I never thought I'll be dry. And when they come to me, they're like, this is BS. What you're saying cannot help. So one of the most important things I also tell them is keep a bladder log. Because if you keep a bladder log, it's objective charting of the process. They can get the log off my website, not a problem. Because it is like weight loss. Can I lose a pound? Nobody will notice. 5 pounds, nobody will notice. At 15 pounds, people will notice. So when you go from 6 diapers to 5 diapers, it is not much, but it's 20% better or 15% better. And every day that you go to a smaller pad and a smaller pad, understand that the volume of leakage is less. A diaper holds about a bottle of water. A pad holds 3/4. Then as you go to smaller pads, they hold an ounce and a teaspoon. So you know you're getting better because you are writing down your progress. And it is hard. It is like any other exercise. Takes us several weeks, like the knee and the hip. But think about it. Would you just if you have had knee surgery, would you just throw your walker and start running the next day? So nothing to be discouraged about. It is a step-by-step process, a little bit counterintuitive, but in the end, it doesn't take that many weeks. It just takes about 10 weeks. But I have now, since last year, established a new protocol because the men are younger. I don't know if everybody's noticed. When I started, men were 80 years old and 75. Now they are 45, 50, 55. So they work. And I've had to change my protocol. And what I have implemented, of course, with my patients, they are the best in the world. Nobody can hope for better. They are happy if I change. We are trying to get men all right in 6 weeks. Now, 6 weeks after the catheter is removed, not 6 weeks after surgery. But once the catheter is out, 6 weeks later, we want them to play golf, go do, yard work, cough, sneeze, jump, dance, whatever they feel like doing. We want them to get back to that position very quickly. As of this moment, that seems to be pretty successful. So I've tweaked around a few things, got a few things changed from that work, and it is coming along. And I do have an app which is going to be out. It's in beta testing. In next month, it will be out. And it has a 10-week program, step by step, which can be followed. I would suggest before surgery, because then when you go, you'll be dry. You already know what to do. So I am a big advocate of getting everything. Prevention is better than cure. If you know what to do, if you have changed your water habits, if you have changed your nutrition, going into surgery, you come out so much better. That's it.
Yeah, and I agree wholeheartedly. We talk about vacuum erection devices here at Tim Medical for men who struggle with erectile dysfunction post-surgery. And I just encourage men, go ahead and get your device. You're probably going to
Ahead of
need it.
time.
Get it ahead of time so that, again, it's less overwhelming when you're coming out of the surgery, out of having the catheter removed. And, the doctor at some point will say, okay, now you can engage with a vacuum erection device. It might be a month, it might be 2 months. That's between the doctor and the patient. And you're saying the same thing. Go in with a plan, already start incorporating the plan. If you're pre-surgery, that month before surgery, start working it so that, again, the unknown has been taken care of.
is taken care of. And also, even with the vacuum erection device, I have one surgeon here who's very proactive. His patients already get the vacuum erection device. They know how to use it. They use it so that when they start after surgery, they are well aware of what to do, what not to do, how to establish a vacuum, and then they recover fast too. The VED, your exercises, what to do, and not just Kegels. Please, whoever you go to, you have to increase your bladder capacity, learn how to drink more water, decrease the soda, decrease the beer, and that way you're well on your way to be dry within a couple of weeks after surgery. It doesn't even take that long.
Thank you. That's perfect. If I could summarize what I've heard so far is gaining control, continence after surgery doesn't happen overnight. It requires a plan. It also requires a holistic approach, not just Kegels, combining physical therapy, lifestyle, behavior, diet, those other changes. So bigger picture, start early, be consistent, and recognize that it's not just a physical health thing, it's a mental health thing. Don't be afraid to engage others in the conversation. You are not alone. There are probably millions of men worldwide struggling with incontinence post-surgery at any given time. So don't feel like you've got to fight this battle by yourself.
That is absolutely right. Almost, like I said, 99% of the men leak after prostate surgery. It is 1% to 2% who don't. So if you think about the number of people having surgery every year, only in the United States, it is about 60,000. Think about how many others. So all those men are in the same boat as you. And know that you will get dry.
Well, I appreciate that. And I do want to just say thank you for sharing your wisdom, your encouragement with us today, and draw attention to everybody who's watching this video one more time. The book is entitled Life After Prostatectomy and Other Urological Surgeries. And it's just a powerful guide helping men to move from a place of incontinence to continence. It's been around since 2014, right? And I've read the reviews. The book is outstanding, and I just encourage men to look at that. I'll put a link to that book. But Vanita, if I could ask you any other way men can find you directly, where would they find you?
They can contact me on my email or go to my website, vanitasrehab.com, and then they can book a virtual meeting if they want. If they say they started with a book, but there's still some little bit left, they still have this one pad, it will require a couple of sessions, but they will be dry. So, or they can email me at hello@vanitasrehab.com. And if they have any questions, my cell phone is out there. It's on the book. It's everywhere. I do have a lot of people who text me, who write to me, and I tell them what to do. So don't hesitate to ask. I am happy to share whatever information I have, because to me, this is my passion. Getting men dry is I think the most joyous thing I do. And the blessings I get are innumerable. I mean, it's just like they bless me every single day. And to me, that has helped me a lot in life.
Well, Vanita, you are a gem, and we are grateful. I think that's outstanding. We appreciate your passion. And I know that you're in Florida, and you said if people want to reach you, they can reach you. They don't have to be in Florida. You've created a system so that they can reach you if they're any other part of the United States. And in fact, you said internationally, you have some men who reach out to you, and that's acceptable. So I'll put all of those links in the description for this video on YouTube and any other place that we put it. We'll make sure all the ways they can find you, any ways they can get the book. It's available on Amazon. That'll also be in the description. But I wanted to, again, express my gratitude for your time and your expertise in this today. Thank you.
Thank you. Thank you for taking care of men. There are not many out there. Most of them are just like, do Kegel or do this or buy this. They need to understand. And I thank you for bringing it to their notice that we have to have a multi-pronged approach. I appreciate you very much for having me on the podcast.